People look at me and they see a healthy woman. But exactly 10 years ago, in 2016, I was given a diagnosis that many in this country whisper as a death sentence. Today, I am sitting here as proof that beyond the diagnosis, there's life to be lived. And beyond the fear, there are stories of hope to be told. This is the Survivor's Desk, a show dedicated to navigating the journey of health and healing. I am Chioma Ikejani. Because I was a late presenter of stage 4 breast cancer, my oncologist looked me in the eyes and told me I would have to maintain a 21-day prescribed treatment plan for life. At first, for life felt like a prison sentence. I sat in that office and I felt the air leave the room. In 2015, I started to feel a lump, but the crazy thing is that I just didn't do anything. So one day, I ended up visiting a friend at a hospital, and I sort of decided that maybe I should have a full physical examination. And that's when I was first really diagnosed. It was real. And I was still in a state of shock because the doctor was talking to me, and I didn't feel that I was there. It was scary. And it's a shocking thing for anybody to be told that they had breast cancer. Not alone to be told that you're stage 4. And I remember the doctor said to me, well, your journey begins today. And I was in a state of shock because I just couldn't believe that I had cancer. Never believed that I would ever have cancer. And so I went home and I made a commitment that I'm going to fight for my life. The first few months of starting to go to the cancer hospital, I really felt for the very first time that I wasn't the person that I was before I was diagnosed with cancer. I've actually never said this before, but this is something that happened to me. And I remember I wouldn't even take the elevator to go up the stairs. I would walk up the stairs. I didn't want anybody that I knew that would see me in an elevator that could identify, oh, why is Chioma in this place? What is she doing? Is she visiting somebody? Oh, she must have cancer. In my mind, I was trying to run away from the fact that I had cancer. And I think that is one of the most difficult things that I've had to undergo in the beginning of my journey. I remember the first time I was getting the chemo. The first few weeks were great, and I kept on thinking, oh, my hair's not going to fall off. And then my hair started falling off, and I had to look at myself in the mirror. And that's actually one of the most vulnerable moments of my life, is when you are looking at your bald head and you don't know whether you're actually going to survive because you're going through the chemotherapy. And what I really didn't expect were nosebleeds, or I would try and eat and I couldn't taste the food, the chemo. Oh my God, my mouth felt like iron or metal. And then I had cold sores inside my mouth. That was really, I couldn't brush my teeth. I had to take, but they would give me medicine and I would take it and it would clear. And then I remember my doctor said, we're going to do an MRI and see how the progress is. And he told me, I remember he ran into the room and he said, I'm happy, I'm happy. And I said, why are you so happy? He said, your report is amazing. Like, your tumors have shrunk significantly. And over the year and a half that I was in chemo, I mean, my tumors just kept on disappearing and shrinking until my doctors told me that we don't even see this, we don't see the tumors anymore. And you don't have to cut your breast. You don't even have to do radiation. Like, we don't even understand.
It's now day 2 of the official lockdown in Lagos and the Federal Capital Territory in Nigeria, and COVID-19 cases continue to increase.
Right, in Abuja, the Federal Capital Territory, major roads, airports, and markets were on Tuesday deserted. How residents will fare during the lockdown is a source of concern due to various levels of preparedness by individuals and families.
Indeed, wow.
My journey changed forever in 2020. During the COVID pandemic lockdown, with airports closed, I didn't leave Nigeria. I had to survive right here, navigating our local hospitals. It was then I realized survival isn't a miracle that happens to you. It's a choice you make every single day. When I said that my life changed, it changed drastically, because I thought that I would come and visit and then I could easily go back and do a check. But as I was trying to go back, the airports were closed down under the COVID-19 pandemic. My doctors in Canada were very worried, because what am I going to do? How am I going to access my drugs? But surprisingly, my drugs were made available. That was the first battle that I won. But the second battle was now making sure that I could do an MRI and a CT scan. So that was really interesting, because where do I do this? I've never had to do it here. I've always did that in Canada. There are actually hospitals in Abuja that have really great machines like MRI and CT scan. And I found that it was fantastic. They were able to give me the read-in. When I sent it to my Canadian doctors, they said, wow, this is great. They were just happy that I was able to continue my regimented treatments. And that was getting my drugs and doing my CT and making sure that there was really, that cancer was not doing anything in my body.
Around cancer especially, government is doing a lot in terms of how to prevent, whether through primary prevention or secondary prevention, and when prevention fails, how to ensure that people who have cancer have the best of care in Nigeria. This government have taken seriously the issue of the establishment of cancer centers of excellence, one per geopolitical zone. Around that, we also have some of our federal tertiary institutions that are establishing cancer treatment centers of their own. And also because of the policy of government in expanding insurance to cover catastrophic health events, you will see that there's a lot of attention to cancer care, because we know that that is a growing burden of disease in our country. Of course, the enabling environment our government has also created is also helping a lot to ensure that the direction of medical tourism is reversed. Recently, an uncle of mine had a heart bypass surgery here in Nigeria. And when we sent all the tests, everything that has been assessed about him, we sent it abroad. They said you cannot get it better anywhere else. Not only that, you can also not get it cheaper anywhere else in the world.
We are blessed at AMC to have the best advanced technology that even I can say that it exceeds some good hospitals in the West. But what I'm more proud of is we are investing heavily to upskill our professionals. This is why I like AMC mission that we are a patient-centered healthcare provider, with King's as a serious partner with a hospital, built her reputation for the last 100 years or so. When you have an internationally renowned partner, now you are raising the bar in terms of who you are going to recruit, in terms of your clinical service strategy, in terms of audit. I like the word audit. In medicine, this is very important. So when you have your colleagues coming from a different healthcare system, which is developed. And they now come to audit you, supervise, support you with the experience they had over the last 100 years. This is very good. Number two, I think the challenge with Nigerians traveling abroad, seeking health care, I'm sure, is not about technology. If you are asking my opinion, it's about trust. Why should I trust you while I have bad experience with my mom, my sister? I went to you at night, I didn't find any serious physician taking care of me. So what AMC is proud of now is not only the fancy building, which is really fancy, which is the most advanced technology, which is truly are, but we are building the trust that if you came here with a loved one seeking for a clinical advice, I am sure that it's going to be an international level clinical advice. I met a lot of OGAs and VIPs in this country. I always telling them, how much money you have if you have an emergency, even if you have your private jet, you cannot make it to UK or France before 5-6 hours. So I'm happy we have this place, and I hope AMCE will inspire too many others. This country deserves, and it has a lot of opportunity and potentials for 100 places like this.
Now, when I walk through those doors with my prescription form in hand, I'm not going there to be a patient. I'm going there to collect my life. Those drugs are the fuel for my next 3 weeks of memories, laughter, and breath.
The work you're doing is excellent because that is where the awareness starts from. We can talk until tomorrow morning about this. We need to really have louder conversations on issues that have to do with women's health, and in particular cancer. We've come a long way. The needle has moved, but it has not reached where it should be. I don't think anybody can confidently say they're comfortable in cancer control in their environment. We certainly are not. We're willing to put a lot more effort at it, and we need cooperation from all sectors: media, government, funding agencies, the banking sector, pharmaceuticals. In particular, I would like to see a situation where Herceptin costs me 20 naira for my patients.
This 21-day rhythm has become the heartbeat of my existence. It requires a level of discipline that most people will never have to understand. It means showing up when I'm tired. It means trusting the lab results even when I'm scared. It means honoring the years of research, the late nights of scientists and the hands of the nurses at the hospital as part of a larger divine plan for my survival. But I'll tell you what I don't enjoy. I really don't enjoy the 21-day cycle. The first 2 weeks, I don't think about it because I really don't have any symptoms with my prescription. But where I start getting nervous is as I'm getting towards the 21 days, I start thinking, oh, now I have to go and see. I hope they have my drugs. And then, of course, they have my drugs. And then when I get my drugs, I have to go to a certified nurse or an auxiliary nurse. And then it's like a subcutaneous injection. So it's either in my arm or in my leg. And no matter how many times I get it, I don't like it. But it's something that I have totally embraced because it's saving my life. Healing isn't just about medicine. It's about the strategy you live by. Strategic compliance is my shield against the noise of misinformation. When you are fighting for your life, everyone suddenly has a secret tea that seems to cure everything. But I've had to build a wall around my 21-day treatment plan. I do exactly what my doctors say. Every 21 days, I receive my prescribed treatment no shortcuts, no medical herbs. I view modern science as a divine gift. It's a precise map designed to keep me on the road of the living.
In literature, we name this maintenance protocol. Maintenance means what? That I always talk to my patient like this. You have an enemy. He is trying to take much land from your body. So my role as an oncologist to help you and your body trying to fight that enemy. So maintenance chemo, and nowadays we have maintenance targeted therapy. So it's not only chemo, we have maintenance endocrine therapy. What the word maintenance means is that the primary protocol was successful to reduce the burden of the tumor to a level where now we need to maintain the good response. For too many patients now, they are lucky, and their oncologist is lucky, that their tumor is highly sensitive to the treatment density. So what I am advising is, keep the density of the treatment as if now you are driving your car on a slope and you are putting your right lower limb on the brake. Please don't remove your foot. Otherwise, the probability of having a serious accident is there. So for those who are lucky to be maintained on treatment and their tumor is still responding, I beg you, continue the treatment. But listen, to be human, we need to strike the balance because we are trying to kill our enemy, but at the same time, there is collateral damage. So the good team, including oncologists, oncology nurses, palliative care consultants and physicians, you should have a system that can help you strike the balance between side effects and how to cope with and the good benefit of the drug. So it is not only to tell you, please follow this regimen for life, but how should I help you to follow it safely?
But compliance also means being organized. Don't let the hospital process break you. Organize your medical history and your records so you aren't waiting for hours just to see your doctor. When you respect the records, the system respects your time.
For a cancer patient, first is they must have their referral letter. That referral letter says a lot about what they have, what have been done so far. Then once they arrive, there must be a histologic diagnosis. And then thirdly, if there are further imaging studies that they have done in the previous center, then they should just come with the original copies of those so that our doctors here can evaluate them. So I think these are the three most important things. But I think what is much more important if they're coming is their state of mind. They need to be sure that once they are here, they are going to meet empathic people who will really take care of them. In addition, particularly for patients who suffer cancer, there is a new unit or process called patient navigation system. That unit is responsible in telling them every single day what to do, what's expected of them at every stage of their illness. And that had really helped.
I turned my kitchen into a pharmacy. Nigeria has the best superfoods like bitter leaf and moringa, often called the miracle tree. I ate soursop, African mango, and apples, and I drank lots of ginger tea. But it's important to remember that we must honor the science. These fruits and vegetables and cures, they are the bricks we use to rebuild the body. Perhaps the most difficult thing I did was to cut out the sugars that fueled my inflammation. I think that's what's really helped me. I believe in science, but I also believe in eating the right food that will complement the medicine. And Nigeria just has the best. I mean, we're so blessed with organic food. What would cost me thousands of dollars in Canada does not even come close. So that's one of the things that I've done very, very well. And I think it's actually help the 10-year journey of maintaining that healthy life. Exercise isn't just for the healthy. It's the medicine for the recovering. A 50-minute walk tells your cells you are still in charge. Movement is the oxygen of hope. You must keep moving no matter how small the space. And I remember a nurse gave me this piece of advice. She said, nobody's going to fight for you unless you fight for yourself. And you have to be a cancer advocate for yourself. We have to believe that we are going to get better, that this is just a journey that I'm going through. And if there is one message that I can give to anybody that is watching this, had I made the move sooner, had I, when I felt that lump, gone and done an examination and checked it out, it would have been cost effective. I would have only had to be on medication for 18 months and not for life. So I keep saying that early detection, it's so critical to screen. It's so critical to check. It's so critical to do that self-examination because you're saving your life and you're saving the grief of family, because we never talk about the families of those that have cancer, because they're also worried. They are also going through the cancer journey with the person that has cancer. So you're doing everybody a lot of favor if you take the time and just test, you screen yourself.
It's a simple advice and a recommendation. So as long as a female with a breast, you have a risk to develop breast cancer. We have a lot of scientific evidence that discovering the disease early will end up with high probability of cure, less intensive treatment, hugely affordable treatment. So please, my advice, learn to do a self-breast exam at least once per month around the menses time. Just try to check your breast. You are the most important healthcare provider for yourself. Just to check your breast, the 5 quadrants once every month. Then, if you have the capacity to go to a place equipped with a mammography, please let's do it once per year, starting from 25 years or more up to 65 years. In some areas in the world, we can do it every 2 years. But my call of action is, fear is #1 barrier for women in Africa or outside to inhibit them from seeking early detection. So it's better to get it early, less intensive treatment, less disfigurement, very affordable treatment, and instead of being a stage 4 at presentation.
This is amazing. This is amazing. This journey has been challenging, and hope can sometimes feel heavy. But I believe that with consistency, complete transformation is achievable, turning small daily efforts into lasting gains. Your diagnosis is just a chapter. It is not your whole story. And remember, early detection saves lives. Until next time, stay hopeful and stay well. This is the Survivor's Desk.